The IMO were in this morning and they called for a total vaccination programme. They said that 75% of the population would need to be vaccinated to achieve herd immunity. They explained what they meant by a total vaccination programme. That's basically everybody having a vaccination which was free to them. Obviously somebody would have to pay for it, i.e. the state. But they suggested that it was necessary. They suggested 2 months ago that it was necessary. Do I understand that from what Mr. McCallion said, that while you do plan to vaccinate 2 to 12-year-olds and you do plan to vaccinate the elderly, that there are no plans for a vaccination programme in respect to the general population in between?
Adult vaccine chair is more than just the elderly. It also includes healthcare workers, and there are other priority groups that Siobhan referred to earlier. I suppose there are still constraints in terms of what's going to be available in the market as well. There has been work going on this for some months. This isn't something that kicks in around this time of the year. It starts almost at the end of the previous winter, and clearly then the vaccine itself is only developed, from the southern hemisphere and through the winter from there. So I suppose the vaccine numbers we have, the give around 1.4 million doses for adults, and the lower number of 500,000 to 600,000 for children reflects the total numbers that are there available, and that deals with the priority groups, and it works on the basis, as I said, of a 90% uptake in relation to the adult vaccine.
No is the correct answer, is it?
Pardon?
For people like me, for example, I've never taken the flu vaccine before, but we live in extraordinary times. Ordinary people who are not healthcare workers, who don't have an underlying condition, who are not normally recommended to take the flu vaccine, and who are not children, there's no plans to introduce a vaccine programme in respect to
No, so it is prioritised going into this winter, Chair, in terms of the target groups that are there. So it is targeting those that have the greatest need in terms of most at risk.
Very specific, the general population who are not in your target group, the general population, there's no plans for a vaccination programme, is that correct?
Other than those that are in those categories that Siobhan mentioned earlier.
So no is the answer. There are no plans for the general population for a vaccination programme outside of the
Yeah, for flu. Yeah, the flu programme in terms of it's the 1.4 and the 600,000 that I mentioned earlier, 500,000 to 600,000.
How it takes 2 minutes to answer one question sometimes. You called for a total vaccination programme. When did you call for that total vaccination programme, and what response has there been to date?
We're not saying that we're looking for a mandatory vaccination programme. We're saying that the HSE should fund a total population vaccine programme. So at the moment, the HSE fund the vaccine only for at-risk groups and for those in the at-risk groups, even on the GMS. So they fund the actual physical vaccine, but not the administration of the vaccine. And we have called then in light of the need to limit respiratory illnesses and flu in the community, we have called for the vaccine to be available on a total population basis, but it is to be available voluntarily. We would encourage the total population, but we don't want to get into the debate of whether it should be mandatory that you get the vaccine or not.
Okay. And have you received a response, or has the IMO received any response on that yet from?
No, we are to talk to the HSE, have indicated they want to talk to us next week about the winter vaccination programme, but we do note in that they have already, and there has been already been an indication announcement that they're looking at expanding the at-risk group to 2 to 12-year-olds, but we would not believe that that would be sufficient.
Okay, so you think it should be free to everybody in the population?
Yes, we think it should be free to everyone in the population, not just the vaccine, but like a properly delivered vaccine programme within general practice should be free to everybody in the population, so that we can improve the uptake, maintain records, and have a real understanding of where we are with a total population cover.
You've mentioned both in response to, I think, Deputy McAuliffe and to me, that it would be within general practice. Is the vaccine currently administered by pharmacists at the moment?
Vaccine can be administered by pharmacists, but our view is that it's better in general practice. Your health record is more complete. It's more holistic approach. Very often when people come in for a vaccine, there's an opportunistic consultation where other issues are addressed. And I think, particularly in the current circumstances, it's safer within general practice.
But would you accept that it is safe to have it administered by pharmacists? I mean, do you think there's a particular danger at the moment posed by pharmacists administering the vaccine?
No, and I don't think we ever said there was a danger caused by promises.
Question. So you don't think it's dangerous for pharmacists to administer it?
No, I don't think it's in the best interest of the patient. I think it's better to have their healthcare needs met within general practice.
But, I mean, which would be the priority? That there be a total vaccination programme, or that the vaccination programme be administered by, in general practice?
Look, that there be a total vaccination programme. Pharmacists do administer vaccination programmes. We are not saying that they shouldn't.
What percentage of the population would require to be vaccinated from the flu to achieve herd immunity?
If you were going on the present system, it's above 65-70% to be effective. Now that's going on the Irish situation in the flu vaccine is available to at-risk groups and people over a certain age. So going on the Irish dynamic, that's what is necessary. But as you say, when you extend it to the whole population, that effective figure could change. That's the point I'm saying.
Yeah, no, thank you. But
what Ms. Klein said, the higher, the better. Because I think, as I said earlier on, just any temperature that occurs in the actual community now will cause an awful lot of psychological worry and will cause economic effects, because we don't, with regards if a child has a temperature or an adult has a temperature, they will have to, the actual quarantine, the time they have to stay at home will have economic effects as well as health effects and psychological effects. So the less temperatures we have, the better.
Thanks. When does the flu season typically start?
It varies really. The flu, it came early last year. Generally, from any time from September to January, it just varies. I think the flu vaccine has come in. It came on time in Australia at the present minute, so we'll imagine that it'll come late October. But last year it came early.
So, if we're to achieve a herd immunity from flu, or if we're going to get the percentage of the population required to be vaccinated, again, everybody's stressing that it will be a voluntary vaccination. I mean, nobody will be forced to, but time is ticking.
Well, I think we've been advocating that we engage with the government about this for the last 2 months. I think since the Minister Harris announced that the vaccine would be extended from 2 to 12, we have been interested to liaise with the department about this, and I think our first engagement will be next Wednesday.
Did Minister Harris, after he made the announcement, was there a follow-up consultation with those who would be administering the vaccine or might be administering the vaccine?
Preliminary discussions with the HSE on this, and like I said, we have to meet them further next week in the context of the rollout of the programme. It is important to note that, we will always encourage everyone to get the flu vaccine, and for employers to make it available to their staff and to get the vaccine. And while it should be, it needs to be got, it doesn't have to, it's not that if you don't get it by the end of October, it's not beneficial. You keep on going while the flu is circulating.
The question specifically was, after Minister Harris announced that he was going to increase the programme, was there a consultation with those who were going to be implementing it carried out?
No, not a detailed consultation. No, we are expecting that to happen now.
Waiting, okay.